ओके, सो हमारे पास शॉक में क्या-क्या आता है? सिस्टमिक शॉक हाइपोपर्फ्यूजन है, द स्टेट इन व्हिच प्रोफाउंड एंड वाइडस्प्रेड रिडक्शन ऑफ इफेक्टिव टिश्यू परफ्यूजन लीड्स टू रिवर्सिबल एंड देन इररिवर्सिबल सेलुलर इंजरी। जिसकी पैथोफिजियोलॉजी है कि सेलुलर इस्कीमिया की वजह से हो सकता है, इन्फ्लेमेटरी मेडिएटर्स की वजह से हो सकता है, फ्री रेडिकल्स की वजह से हो सकता है। सेलुलर इस्कीमिया होगा तो ऑक्सीजन कम होगा, ऑक्सीजन कम होगा तो माइटोकॉन्ड्रिया कम होंगे, एटीपी नहीं बनेगा, ये सोडियम पोटेशियम पंप काम करना बंद कर देगा। एक बहुत इंपॉर्टेंट बात है कि जो लाइसोसोमल डैमेज है, दैट इज द पॉइंट जब इस सब की वजह से लाइसोसोमल डैमेज होता है, दैट मींस दैट इट इज इरिपेयरेबल सेल डेथ नाउ और कॉरेस्पॉन्डिंग टू द क्लिनिकल रिवर्सिबिलिटी। और क्यों होता है? वो एक ज़्यादा हो जाता है, लाइसोसोमल मेम्ब्रेन हो जाती है और हाइड्रोलिटिक एंजाइम वापस से जब रिलीज हो जाएंगे तो द सेल तो वापस सारा हाइड्रोलिसिस होना स्टार्ट हो जाएगा एंड इट विल बी जस्ट कंटीन्यूअस डेथ। एंड then we have the second part, which is the inflammatory mediators that are mostly the endotoxin that are produced by gram-negative bacteria. They are detected by macrophages, which in response to that release TNF alpha and interleukin 1 beta, and in result vasodilatation, edema occurs, and with decrease in ATP, oxygen demand is increased, and cell metabolism it worsens. Then we have also due to the lack of oxygen, anaerobic respiration produces lactic acid, which in turn makes lactic acidosis, which the increased production of lactic acid will put the body in the state of metabolic acidosis. And then we have the free radicals, which are due to calcium in the cell. Calcium in the cell and potassium in tissues. Then we have reperfusion. In reperfusion, oxygen and damaged mitochondria makes free radicals. So there are two things that are making the reperfusion injury possible, which is why first is potassium and second one is the free radicals. The potassium is accumulated in the tissues. So when like blood returns, like if we are giving oxygen immediately and when oxygen is given, blood normally starts circulating. The potassium, all of the potassium returns into the blood. When it enters blood, it moves to the cardiac muscles and it may lead to myocardial infarction, hypertension, and arrhythmias. And the second thing was for the free radicals, and the free radical damage causes endothelial damage, and consequently there is lung injury and kidney injury and leads to failure. And then we have two types: either the shock can be compensated or not compensated. Compensated would it means that the body is trying to repair the damage, and that will lead to tachycardia and cold extremities, and the body will be in the state of metabolic acidosis because blood supply to the non-vital organs will be reduced, and hence less oxygen. Less oxygen means conversion to um, the anaerobic respiration. Respiration will produce lactic acid and then metabolic acidosis. Then we have um, mild, moderate, and severe form of decompensated shock. In mild, there will be tachycardia, tachypnea, less urine output, pulse pressure will decrease. Pulse pressure decrease means that systolic pressure will be normal, but diastolic pressure will increase due to vasoconstriction, hence the pulse pressure decrease, and cold peripheries. Then moderate, everything will be the same, except that the urine output would be as low as 0.5 per ml per hour per ml per kg per hour, and BP will be low. Then in severe shock, we'll have tachycardia and hypotension with labored breathing, and urine output will be 0.